Hello, my name is Denise Noto, RN BSN, and I am giving my reflection for the phase one portion of D026. One thing that they had asked that we reflect upon was our LinkedIn job description research. I thought that was really interesting to go on LinkedIn and other sites and find job descriptions and salary descriptions of jobs that advanced professional nurses could have in quality. And that whole initiative to bring value-based care to hospitals, to really any medical providers, office, clinics, anywhere. There were a lot of positions. I'm in the Northeast in Connecticut, so in the tri-state area, there was a lot of positions. Some of them required a master's. Some of the people who I talked to actually started, in different positions, safety positions, and then they gradually worked their way up to be a quality manager. So I thought that was very beneficial to kind of bring what we're learning and see what can we do with it when we have our degree. That's really cool. It's kind of hopeful and exciting. Also, when we did the mapping of the quality nurse responsibilities, I thought it was cool. The American Association of Colleges of Nursing, that everything is so sort of predetermined. The vision is there. What are nursing responsibilities? What are they once you get into the quality nurse area? What are we supposed to learn? What are we supposed to do? What are we in charge of? What can we be participating in really in these bigger institutions? And what can we bring to improve really patient care by serving populations and creating less waste of time and resources? When I created the job description for a quality safety manager, there was lots of good descriptions out there, so I felt like, okay, I can do this. And when I met with the quality manager for the hospital that I work for, Danbury Hospital, she is responsible for my unit, but also responsible for a lot of other places. She looked over the description and it was kind of fun because she was like, yeah, I do that. Yeah, I do that. So that was cool to talk with her. It was a good lead into that conversation. She actually is part of a health system. It's called Nuvance, and they work with 7 hospitals. 3 of them are in New York State and 4 of them are in Connecticut. That makes up the system. And in her position, she's in charge of the lab, GYN surgery, pathology, outpatient collection, wound care centers, public community health centers, dental, patient services, all of those things. She's really focused on the laboratory and, any mistakes that were made, how can we better manage that, reduce costs, that kind of thing. We talked a little bit about root cause analysis and MIDAS reporting system, and also, of course, just Joint Commission. So it was very helpful to talk with her and just see what exactly she does. So thank you very much for listening to my reflection.